Med History.
Cherubism. Familial hereditary fibrotic osteodysplasia is a rare genetic disease that causes a defect in the lower part of the face in the form of a symmetrical thickening of the lower jaw or both jaws. The disease was first described in 1933 by W. A. Jones in Kingston. In 1938, Jones named the disease cherubism, as the faces of the patients resembled cherubs in Renaissance paintings. However, this name is not quite correct, and probably cherubs in this context were mixed with puto. Later, an autosomal dominant type of inheritance was discovered, the clinic of cherubism. The disease can begin shortly after the birth of a child, or at 1.5, 3 years old. A clear picture is determined by 15, 18 months. Relatives and surrounding people do not see this pathology and attribute it to the manifestation of the child's fatness. At the same time, there is a symmetrical swelling of the bone of the lower jaw in the area of both its corners. The face acquires an almost square and puffy rounded shape, resembling the face of a cherub. The progression of the disease is noted during puberty. At the same time, patients note pain in the affected area. After the end of puberty, the process stops and the jaw size decreases. The reverse development of the process is possible. The examination determines the characteristic deformity of the face. Domed swellings are palpated in the area of the corners of the lower jaw. There may be pronounced edentia to one degree or another, violation of the timing of eruption, shape and localization of already erupted teeth. Violation of the laying of dental rudiments is a characteristic feature of cherubism. The pathological activity of the SH3BP2 gene affects the immune system, causing its hypersensitivity and osteoclasts. As a result, inflammation occurs, primarily in the lower jaw, although the upper jaw may also be involved in the process. Inflammation activates osteoclasts, which in turn destroy bone. In combination with inflammation, this leads to the formation of cysts and an enlarged jaw. Changes in cherubism are not a neoplasm, since unlike a giant cell tumor, there is no hyperplasia of osteoclasts and osteoblasts. Histological method reveals a large amount of cellular fibrous connective tissue, with nodules from clusters of osteoclasts with rounded oval monomorphic nuclei. Diagnosis is based on the identification of characteristic clinical and radiological signs. Palpation of the jaw is usually not painful. The consistency of the pathological formations detected by palpation may vary depending on the stage of the process and the age of the patient. In children, these formations are more elastic and malleable, while in adolescents they have a denser consistency. The main radiological signs are the symmetry and uniformity of lesions on both sides. In the lower jaw, changes usually occur at first in the area of corners and branches, then spread to the body of the jaw. Usually the coronal process is involved in the process. The X-ray picture of the lesion of the upper jaw is less characteristic, but usually manifests itself as a pathological shadow in the maxillary sinus. Various changes in the bone structure are possible. After 10-15 years, the ossification process begins in the area of pathological foci, which leads to the restoration of bone structure. As a result of the pathological process, moderate deformation of the mandible and various radiological signs of destruction or sclerosis can be observed. The differential diagnosis of cherubism is relatively simple. It differs from other tumor-like diseases of the facial skeleton by its familial hereditary character, the symmetry of the jaw lesion, dental anomalies, and a characteristic X-ray picture. Manifestations, typical signs/symptoms about painless bilateral symmetrical enlargement and compaction of the lower face. Possible lesion of the lower jaw or both jaws. Enlargement of the upper jaw is usually less pronounced compared to the lower. Enlargement of the lower jaw is usually symmetrical. The enlargement of the upper jaw may be asymmetric. Other signs and symptoms. Premature exfoliation of temporary and permanent teeth, especially the first and second molars of the lower jaw, displacement, malformation, agenesis, ectopia, lack of teething. The effect on the development and teething varies depending on the time of onset of the disease and the severity of expansive lesions. When involvement of the upper jaw, impaired speech, breathing, swallowing, chewing, proptosis, eye rolling, eyelid retraction, diplopia, visual impairment due to optic nerve atrophy, retraction of the lower eyelids, gaze directed to heaven, cherubic face. Clinical profile about a young child with a painless bilateral enlargement of the jaws. Cherubism is a rare genetic disease characterized by deformity of the face and skull. Patients with cherubism have severe shortening of the skull, an elongated nose, widely spaced eyes, and other anomalies of the facial skeleton. This condition is caused by a mutation of the gene responsible for the development of the facial skeleton. Although cherubism is not a life-threatening disease, it can lead to serious breathing, vision, and hearing problems. Treatment of cherubism usually involves surgical correction of facial and cranial deformities. Although cherubism is a rare condition, studying it helps scientists understand the development of the facial skeleton and may lead to the development of new treatments for other genetic diseases. Due to the complexity of treatment and the rarity of the disease, patients with cherubism require multi-specialty treatment by specialists in facial surgery, orthodontics, ophthalmology, and other fields of medicine. Cherubism reminds us how important it is to understand and research genetic diseases in order to develop effective treatments and help patients with rare diseases on the road to recovery. Historical information about religion. Cherubism is a religious teaching that originated in the early centuries of Christianity and subsequently became the dominant Byzantine trend. The history of cherubism begins with the appearance in Christian art of images of cherubim, celestial beings described in the Bible. Cherubim were depicted as two winged creatures with four faces: human, lion, bull, and eagle, symbolizing the four evangelists. Over time, the doctrine of cherubism continued to evolve, becoming more complex and philosophical. Cherubism preached the idea that a person should strive for spiritual perfection through repentance and inner transformation. The main center of cherubism was the Patriarchate of Constantinople, where ceremonies and communities of cherubists were often held. However, over time, cherubism began to face competition and criticism from other Christian movements. As a result, in the 8th century, cherubism was condemned as a heretical doctrine at the Seventh Ecumenical Council in Nicaea. From that moment on, cherubism gradually lost its influence and began to retreat before other branches of Christianity. Nevertheless, the doctrine of cherubism still remains part of the Orthodox tradition and can be found in iconography and the ecclesiastical tradition of many Eastern Christian churches. In the modern world, cherubism continues to influence Christian doctrine and art, maintaining its importance and interest for believers.